Thanks, Matt. So hi, everyone. Great to be here. Yeah, my name's Ben Barr. I'm Professor in Public Health at the University of Liverpool. I'm going to be talking about just some of the highlights from research that the team at Lilac has been involved in. And we have all the members of the team there up on the screen. And this is really some highlights from work that we've been doing, that the team has been doing, focused on trying to understand what is the impact on health of spending and investment by local government. Move my slides on. Okay, there you go. So the School of Public Health Research is organised around these three programmes: the Children, Young People and Families programme, Places and Communities, and Public Mental Health. And we also have these cross-cutting themes. The work that I'm going to talk about is really a collaboration, particularly between the Places and Communities programme and Children and Young People. So I'm sure many of you will be aware that there's been huge cuts in local government since 2010. By 2015, local government's budgets have been cut pretty well by 50%. And this was a response to the global economic crisis in 2008 and the subsequent austerity programme that was implemented by the UK government. But those cuts haven't been equal across different areas of service provided by local government. Some areas have been cut much more than others, and this just shows a table from Michael Marbot's recent report showing the cut in local government spending across different service areas. And the areas that have been cut the most are things like planning, housing, culture. Areas such as social care have been a bit more protected, but still have been cut. There's actually been an increase in spending on children's social care. But as we'll see in a minute, that is actually hiding some very important cuts in children's services. So what we look at is what effect has this had on public health? And what we'd expect from the sort of what we know about the social determinants of health, that many of these areas would have potentially large effects on health. But trying to understand the kind of causal relationship between those things is challenging. And one of the things that we use is looking at differences in how those cuts have happened, those cuts in spending have happened across different parts of the country, because they've been very unequal in the way those cuts have fallen. So this just shows gross expenditure, so total expenditure per head by local government across England, Scotland and Wales, broken down by area deprivation, so the level of disadvantage in different areas based on the indices of multiple deprivation. With the red line at the top is the most deprived areas in each country. And we see that they start off, more deprived areas have higher levels of spending, reflecting the higher levels of need in those places. In England in particular, the reduction in spending over that time has been much greater in the more deprived areas. We don't see that same differential across Scotland and Wales. The cuts have been much more equal across places based on their level of deprivation. When we look at specific areas of service, so this is looking at this cultural, environmental and planning services. So that's things like libraries and leisure centres, parks, those kind of things that local government are investing in. We see that those areas have been cut much more, but also the relationship with deprivation is even steeper, with them being cut particularly severely in the most deprived areas in England, that is. Again, we don't see quite the same pattern in Scotland and Wales in the relationship with the level of deprivation. And this is particularly important around with this group of services, because the government is currently proposing, is using the lack of relationship with deprivation in current funding, so the funding we see in 2017, as a justification for actually removing any relationship with deprivation and need from the formula that's used to allocate funding to places for these services. So if we look at children's services, we also see a similar pattern. Again, here the blue line at the top is the most deprived areas, and the red line at the bottom is the least deprived. And we see this is spending on Sure Start and early years services. And again, we see this has been cut by around 50%, and those cuts have been greatest in the most deprived areas. You'll remember from the slide earlier that there's actually been an increase in overall spending on services for children. So you might be wondering how that can be the case when there's been cuts in these preventative services. But that is entirely because at the same time there's been huge cuts in prevention, there's been a huge increase in spending on child protection and children being taken into care. So we have cuts in prevention happening at the same time as the consequences of not having preventative services increasing costs for local government. So what effect has this had on health? And we've got a number of different studies. Some of them are more advanced than others, but some of the early findings from those studies I'll just talk about briefly. We know in terms of life expectancy that life expectancy basically has pretty well stalled since 2010 to 2012, have been increasing fairly rapidly, and then those improvements have flattened off, and those more recent adverse trends have been worse in more deprived areas, and inequalities have tended to widen. And people have suggested, like Michael Marmot in his recent report, suggested that this increase in inequalities may well be related to these changes in local government funding that we've observed. But trying to look at the potential causal relationship between that and these outcomes can be quite difficult. One of the things we've initially looked at, and one of the issues with trying to understand those relationships, is that if need increases in an area, for example, if there are more people needing social care services, that increases the costs that local authorities have and their spending, but also increases risks from mortality or from people dying. So you can get what's sometimes called as reverse causality. So one of the ways that we try and overcome that is looking at changes in specific central government grants that won't be affected by these short-term fluctuations in need. And when we look at the main central government grants, we see that those places that have received the greatest cuts in these grants from central government have experienced the most adverse trends in life expectancy. And in the longitudinal analysis that we've carried out for that, we've shown that these cuts in the central government grants account for an additional around 10,000 additional deaths under 75 in England between 2013 and 2017. So it does look like some of these adverse effects on stalling life expectancy are potentially related to the reductions in local government budgets. A further study that we've got, led by my colleague Devara, is looking at the effect of cuts in spending on children's prevention services and increases in children being taken into care. And we find quite a strong relationship, particularly on prevention spend for teenage children, so cuts in kind of youth services, and we see that places that have had the largest cuts in those services have seen a consequent increase in teenagers being taken into care. For about every 10%, £10 reduction per child for those services, we see an increase in 2 children per 100,000, 2 teenagers per 100,000 being taken into care. So there does seem to be, as you might expect, that when you cut these prevention services, we are seeing an increase in the adverse consequences for children. Similarly, a study led by my colleague Kate Mason is looking at the effect on childhood obesity from cuts in Sure Start and early years services. And we see a small but significant effect with areas where early years services have been cut more, seeing a greater increase in childhood obesity. For every 10% cut in the spending on those early years services, we're seeing about 0.34% increase in childhood obesity. It's quite a small effect, but that accounts for about 5,000 additional children with obesity over the period since 2010. So, overall, we see across a number of services that the reduction in spending on those services does seem to be leading to some real consequences for public health, both amongst adults in terms of mortality, but also some of these important outcomes for children. And so, I mean, why is that important? I mean, it might be that it's kind of obvious that if you cut those services, there will be consequences, but it is clearly important that we demonstrate the impact of those decisions on public health, but also this research indicates the potential benefits of investment across these different service areas and can inform not just national decisions around investment in local government, but also decisions how specific local governments share out their budgets between service lines and which ones are the most beneficial in terms of public health for them to invest in. And finally, there is, at the moment, the local government finance is going through a major review. And at the moment, there is a real lack of appreciation amongst people working in local government finance of the outcomes that investment in local government can achieve in terms of public health. The government has just had a consultation. We've had a consultation in 2019 on how they assess need for local government funding, so how much each place would get according to its level of need. And for most of the service lines that we've been talking about, that consultation doesn't mention health at all as something that drives need for local government services, particularly around things like the environmental services. So this work is providing potentially crucial evidence that can inform the government's policies on how it decides on the level of need for funding from local government. And of course, with the current pandemic, that has made all these things much more stark, and this level of disinvestment from local government has potentially made particular communities more vulnerable to the current pandemic. Thank you.
Thanks for having me. So my name's Claire. I'm from the University of Hertfordshire, and I'm going to be presenting on behalf of the TfL study team. Please excuse my front door that's going to start banging in a minute. I've thrown them all out. It should be nice and quiet now. So the presentation's going to be on a media analysis we did of the advertising restrictions on the Transport for London network, so very commonly referred to in the press as the junk food ban, which would have been 2 years ago now. As you probably all know, kind of in response to children's diets and childhood obesity, food advertising to children has been regulated on television for quite a while, but as part of a kind of a wider body of work, that's not me, I promise, as part of a wider body of work to kind of tackle childhood obesity in London. In February 2019, Transport for London, headed by Sadiq Khan, the mayor, they brought in some advertising restrictions on the advertising of higher fat, salt and sugar food, so HFSS or junk food, on its network. And this was really significant because Transport for London owns one of the most valuable outdoor advertising estates in the world. So there's quite a lot of money involved in this, and it was quite a big deal in the press and quite symbolic. And also quite controversial in the press. So initially it had sort of very high public approval, but it was also very hotly debated. And this wasn't something I think that we were originally definitely going to cover, looking at the media representations of it. But as the study was ongoing and all this was going off in the press, I kind of decided that this is something we should focus in on. So there's a nice timeline on this slide that wasn't made by me, it was made by Rebecca Meixin, who's a research fellow on the project, and I've just taken it from a paper she's about to submit. So thanks, Rebecca. Just to give you an idea of the timeline. So May 2018, there was a launch of a public consultation on the restrictions. In the November, they announced the policy was going ahead. In the following February, it was implemented. And then later on in the year, after some teething problems, they updated the guidance. And how a food or a drink is defined as HFSS or junk food, they use the nutrient profiling model, which is the same one they use for television restrictions. So per 100 grams, you kind of get, and I'm sorry if I mangle this, like the bad foods and then take away the points for the good food. So it's a points-based system, so it balances out. So if you get a score of 4 or above, then that's a HFSS food, that's junk food, and then it wasn't going to be advertised. So quite a blunt instrument in some ways, but there was an exceptions process again, and it was cushioned. So this is the thing that we're really interested in looking at in the press. And the aim of this part of the work and of the paper was to kind of identify the rhetoric used in UK newspapers to argue against the restrictions. So there are arguments for, but we're really interested in the ones against, because then, you know, within public health, they're the ones that we kind of have to take issue with. So if to jog your memory, if you remember, it was Sadiq Khan who announced it. He was very much the figurehead for it, and there was an awful lot of in the press about it, and we've got an example there. So in order to do this, to look at the ban, we looked at UK newspapers and trade press, and the search period was from the beginning of March 2018 till the end of May 2019. So we wanted to cover the launch of the public consultation, as in on the previous slide, and then the announcement that it was going ahead, and then the implementation. And we searched Factiva, I can never say it right, sorry, for the news coverage, and then also manual searches on Google. And I'm using the royal we, I didn't search it. Christelle and Vanessa, who both work on the project, who are named on the last slide, they did the literature, they did the article search. And it gleaned 152 articles. So once we had the articles, the first step was a thematic analysis, so we can like just do a broad brush, arguments for the restrictions, arguments against the advertising restrictions. And then once we had the arguments against, we focused in on them on a document analysis, because that's the bit we're interested in. Why are they saying that this, you know, quite popular policy to stop so-called junk advertising to children to reduce childhood obesity, why is that considered a bad thing in some of the coverage? So if you have a look at the spread of those articles as they were selected, so as you can see, if you think light green is the national newspapers and dark green is the local, so a lot of interest, and you can see the spikes in coverage around. The first one is the launch of the consultation, and then later in the year, the announcement of restrictions, and then another spike around implementation. But obviously it was quite hotly debated, and a lot of that coverage is when it was first announced. So when we look specifically at arguments against the restrictions, against the ban, they all tended to be based on two central claims. So the first way of kind of saying that this is an intervention that shouldn't go ahead was to say that childhood obesity was not an appropriate problem for TfL to try and tackle. And then the second claim that was, even if they did try and tackle it, advertising restrictions were not the right way to go about it. So it all kind of hinged on this. And there's three main ways in which these claims were justified. So first, they identified more important alternative priorities. So you shouldn't be focusing on childhood obesity. There's this going on, there's that going on. All these things are more important, very typically violent crime. Second way of doing that was by kind of undermining the evidence or the science behind the restrictions. So how do we know it will work? What proof have you got it will work? The nutrient profiling model, that point system, that's faulty. So undermining the science. And then the last one was kind of highlighting the potential costs of the restriction. So saying it's going to cost an awful lot of money and it's all going to go horribly wrong and it could be the end of TfL. That was kind of the implication. So I want to take you through a couple of examples of each of these. So more important alternative priorities. So you've got an example here from the Daily Star. So if you remember at the time, this was in the press, there was also quite a bit in the press about knife crime and young people and gangs and violent crime. And this was constantly put up as something that should be tackled instead. You know, why is the mayor focusing on childhood obesity, on advertising? There should be much more, you know, violent crime is life or death. This is a much more important priority. So this particular extract is after Sadiq Khan got a bit of a grilling on his policy on breakfast television. And this is a tactic that's used a lot with tobacco and alcohol industries and the food industry. So it's not a new technique to say you shouldn't be focusing on this. There are more important things. There are other priorities. Casting doubt on the science, and this was probably the most popular one, especially around the points-based system, because it would mean that things like olive oil and hummus or condiments in general, really, because of the way they're made up, wouldn't be allowed to be advertised. So you couldn't have images of them. And this kind of also got bound up with lots of cultural claims about food and nostalgia. And if you're interested in food sociology, all that type of thing. So there'd be lots of criticisms about, oh, you know, what about ice cream vans and your grandmother having jam and scones and things your grandmother would have eaten? And what about wholesome things like olive oil and class claims? So at the same time as saying that the NPM, this points-based system, didn't work, also tying those criticisms to senses of national or classed belongings or nostalgia. So really quite emotive. I think if you remember any of them, you might remember that strawberries and cream at Wimbledon couldn't be advertised, and there was a lot in the press about that, and Farm Drop had a lot to say about it as well, as you can see there. And the last one, of course, is the potential costs. And again, not a new one, but saying that it's going to cost millions in lost revenue, that's going to be less money to spend on the network. That could be fare rises for passengers. It could leave a hole in TfL's budget. All these terrible things will happen because there won't be enough money as a result of this ban. So this was also quite a popular one as well. And again, like the where is the evidence, the science is flawed. This one as well is kind of not a new tactic. So this is a kind of industry claims. But interestingly, this is coming from the press, picking up on those industry claims, or using that language. I think to summarise, it's interesting that these claims come from quite a well-worn industry rhetoric about it, but in this case, it's coming up in the press. And we know, counter to those claims, that in the longer term, most public health interventions are kind of cost saving because they reduce pressure on services. So that kind of undermines the claims about it's going to cost too much. Very often, even if those restrictions target industry, they don't tend to result in long-term negative impacts for industry. We didn't see large spaces where there would have been adverts or anything. And a lot of the criticisms of the ban, they didn't acknowledge the finer details. There was an exceptions process and there was extensive guidelines on the restrictions as well that could be engaged with. And these claims that tended to be around, oh, there's not enough evidence, the NPM is flawed, we don't know if this is going to work. None of these claims tend to say exactly what sufficient evidence might be. So they're very difficult to argue against. So I suppose in summary, if you think about the rhetoric to argue against structural interventions like this one. It's very similar to the stuff that we've seen before. And it's this idea it's not the right priority. And even if it were, this is not the right way of going about it. And these are kind of taken from harmful commodities industries. And it's towards this kind of general way of thinking about public health as lifestyle risk and individualizing it, and around that kind of narrative of choice, which unfortunately didn't have a great deal of time to get into about this, but that kind of underpins it. And some of the things we've identified that could have been more, I suppose, more emphasised to defend the policy and to defend interventions like that is highlighting the positive outcomes. And arguably there were some from this that we didn't see so much in the press. So it did serve to lessen advertising of so-called junk food products, which would be a good thing, and thereby increasing space for the advertising of healthier foods and encouraging brands to reformulate their products so they've got healthier versions so that they can advertise them. So those are some of the things in the paper we're just submitting and redrafting that we think that public health advocates could focus on more. So thank you for listening to me, and the rest of the research team are there, and please let me know if you have any questions. Thanks.
So this is some work, and all the people who've worked on this project, their names are listed here. And I'm going to rush through some of these slides because I have way too many slides for the 10-minute presentation. So I was just starting with a general definition of the food environment so everyone knows what we're talking about. So it's kind of any opportunity to obtain food from the macro down to the micro and how that influences what people eat. And policy making the food environment. So this, I guess, ties in with some of the things that Ben was saying about cuts with planning, that and how it may influence health, which kind of isn't fully acknowledged. So since 2013, many public health responsibilities, as everyone knows, were moved to local authorities. And there's been increasing interest in how local authorities can shape the food environment, particularly by engaging with small businesses. So that's basically how planning can influence health and when this happens. So this is all relatively new as within the last 10 years. And going forward, it's important to understand the timeframes for how effective this is and how it influences health. And that's what part of this project does, and that's kind of what going forward from this project we hope to do. Okay, so we have important health inequalities around access to healthy food, as unhealthy food sources tend to cluster in more deprived areas. And because of this, planning policies tended to focus on restricting new hot food takeaways. And approximately 50% of local authorities have these planning restrictions to restrict new hot food takeaways. However, there has been no evaluation of how effective they are and what influence they have on the food environment to date. So to address this issue, we were first started by looking at the validity of this data set, which is the Food Hygiene Rating Scheme data. So this is a data that's collected by environmental health officers for all local authorities and all food businesses that sell food that's not sold just at room temperature. So that includes convenience stores, garage forecourts, cafes and shops, schools, care homes, hospitals, everything that has food. But restaurants, pubs, bars needs to be inspected. And we first looked at the validity of this data to evaluate interventions in the food environment. So part of that is most of the planning documents relate to a geographical distance. So many of them say you can't have new takeaways within 400 meters of a school, or 200 meters of a school, or within some other distance. So we have to know how geographically accurate this data is to be able to capture the nuances of this policy for any evaluation. And we also needed to check that this data is by law supposed to be updated every 28 days. So we wanted to check to see, how accurate it was by looking at the food outlets in the field, how they match to data as and when it's collected. So to do this, we did a field audit to assess the validity and spatial accuracy of the data in 5 lower layer super output areas. So that's a small geographical area of approximately 1,000 people. So it can vary in size. So LSOAs in rural areas are much larger than LSOAs in urban areas. So we look at some in the northeast of England, particularly in Gateshead and Northumberland. And we look at all potential premises selling food in the chosen LSOAs, and they recorded them and compared them with the data that had been collected by the Food Standards Agency. And we assessed validity against the field data using positive predictive values, and sensitivity and spatial accuracy was evaluated by a mean straight line differences between the coordinates in the Food Standards Agency FHRS data and the field coordinates, which was taken by the researcher using the GPS on their phone. So what we found is that 182 premises were present in the field, which 162 were in the data and 20 were absent, and that was a sensitivity of 89%. And we found a PPV of 95%, and the spatial accuracy, so that we measured as less than 100-meter difference between the FSA data and the field audit data. We found that for 77% of outlets, and we found no difference in how outlets recorded when comparing high and areas of low deprivation. And we found that the mean distance was significantly smaller for outlets in rural SOAs. That means they were recorded more accurately, but this might have been influenced by the fact that there was one urban location with 15 outlets, and that could have slightly skewed the results. So overall, I found that the data should be valid and spatially accurate for evaluating a planning guidance to promote healthy environments. As most planning guidance limits the change of business, as I said, to within 400 meters, we found that 77% of businesses were accurate within 100 meters. So then the next step is we looked at doing an evaluation of Newcastle City Council's supplementary planning guidance. And so their SPD is related to schools, so it creates exclusion zones within 400 meters of secondary schools in Newcastle. And this shows there are 18 secondary schools in Newcastle, and this shows the red blob are the different exclusion zones around the schools. And so we use the FSA data taken from 2012 to 2019, so pre-planning guidance was 2012 to September 2016, and post was from October 2016 to 2019. And we do the analysis by postcode. So we have over 358,832 observations on 44,854 postcodes over 8 years. And what we do is we look at some postcodes in Newcastle will be inside an exclusion zone and others will not. So we use a quasi-experimental approach to look at the number, type of outlets and areas that are in the exclusion zone compared to those that are not. And so then this is just matched. So we look at the little red dots here are those outlets which are in the exclusion zones, and the green dots are those that are surrounding them. And this just shows how it fits into the map of Newcastle, because I don't have the mapping skills to be able to put it onto an actual map of Newcastle, but hopefully that makes sense. And so then this shows how many new takeaways and restaurants are there in Newcastle. So these are in the control zones, so that's those that are not impacted by the planning guidance. And we can see that there's, well, I guess the first thing to show is that there's not very many new outlets that open overall, but from the raw data, there's a little small jump just after the implementation of guidance, and there's no real change in the exclusion zones. And for restaurants, you can see that there is also a little jump. Again, the numbers are very small, and there is not much change in variation in the exclusion zones. And we can see overall in the first 3 years after the implementation of SPD that there has not been really much change to the food environment at all. So there's no differences, and these are the different type of outlets, and there's no change overall in the type of outlets. And also there was no impact on existing outlets, because one of our theories was that if there was a limitation, that those outlets that were existing might do better, but there was no change. So then some things to think about going forward is how applicable are these results to other local areas with similar guidance? And as well, there's been a planning white paper which might completely change how planning system works, creating a blanket ban on takeaways everywhere and what that means going forward and how that might impact on health. And also how do different types of these SPDs, because they're not all the same. So for example, Gateshead has a more blanket ban. Has this led to a greater change over a similar time period or not? And as well, the food environment is ever changing. So thinking about post-COVID and how that will impact on the hospitality sector and what that means for creating a healthy environment for everyone. And then that's it.